Savez-vous qui je suis? Force du monde et mère du vivant, je suis partout. Chaque jour, à chaque seconde, je relie toute forme de vie. Je suis une arborescence, un réseau qui s'anime, une terre d'échange, une convergence. Souffle invisible, onde qui se propage. Je suis une énergie, un battement d'ailes, un lieu de passage, un lien inaliénable entre les êtres et leur milieu. Je suis une science, une vérité née de l'observation et du partage, unique voix portée par le dialogue, condition de l'équilibre et bien commun, indivisible par nature. Vous êtes, donc je suis. Une seule santé.
I am, therefore you are. What a powerful message. Your Excellencies, dear Presidents, Prime Ministers, Ministers, Members of Parliaments, members of the science, of the civil society, all of you, thank you so much for your presence and welcome to Lyon. My name is Eleonore Caroit, and I am the French minister in charge of international partnerships, and I will have the pleasure of moderating this high-level session of the One Health Summit. It is my very pleasure to welcome you all for what has to be a turning point in the way we tackle global health. Governments, scientists, international organizations, philanthropies, private companies, and civil societies have gathered here in Lyon, a city with a historic and driving role in global health, to implement the One Health approach. But now, ladies and gentlemen, it is time to deliver. In a moment, we will have the honor of welcoming to the stage the co-chairs for this summit, the President of the French Republic, Mr. Emmanuel Macron, and the President of the Republic of Ghana, Mr. John Dramani Mahama. We will then invite 3 distinguished panels on stage to explore the fundamentals of the One Health approach and to announce concrete commitments. Before we begin, let me just give you a few housekeeping rules. A translation set is available on your chairs. You should be able to listen to the conference in English and in French. If you do not have a set, please raise your hand. Someone will bring you one. And now that I've made that announcement, and as Minister of Francophonie, you will allow me to switch to French. Sans plus attendre, je vous prie de bien vouloir accueillir
Without any further ado, I would ask you to extend a warm welcome to Mr. Emmanuel Macron, President of the French Republic.
Messieurs les présidents, Monsieur le Premier ministre,
Presidents,
Monsieur le
Prime
directeur général
Ministers,
de l'Organisation mondiale de la santé,
Director General of the World Health
Mesdames et Messieurs
Organization,
les dirigeants d'organisations internationales,
directors
Mesdames
of
et Messieurs
international
les ministres,
organizations,
Mesdames et Messieurs les
ministers,
parlementaires,
members
Madame la
of
préfète de
Parliament,
région, Mesdames et Messieurs
local
les élus, Mesdames
prefect,
et Messieurs,
all
en vos grades et
elected
qualités,
members,
chers amis,
ladies and gentlemen, in your different capacities,
c'est
dear friends.
un grand bonheur, une grande fierté de vous
It's a
accueillir à
great
Lyon
moment
pour
of joy and pride to
One
welcome you
Health
here to
Summit,
Lyon for this
comme vient
One
de
Health Summit,
présenter Madame la ministre.
which has just been presented
toute
by
chose,
our minister.
Permettez-moi d'abord de
And
partager avec
first
vous
of all, I would like
la
to
grande joie et le
share
soulagement de
the
savoir
joy and relief
Kohler et
that we
Jacques
feel
Paris,
that Cécile Kohler
libres
and Jacques Paris, the
et
French
sur le chemin du
hostages in
retour pour la
Iran, are
France.
now free and they are on their way back to France.
C'est une formidable nouvelle, je pense.
This is a wonderful piece of news, and I would like to extend a thought to their family, all their friends, and all the people who took action to defend their cause, and all the administrative authorities in the French Republic who worked with them in their embassies and so on. Now, ladies and gentlemen, we are here in Lyon today. First, it is World Health Day, as Dr. Tedros pointed out. This is an opportunity for us to look at the world as it is. It is a world in crisis, and these are crises which divide us. There are wars which have really changed our supply, security, and questions of strategic self-sufficiency. And we can see the challenges to world health which require greater cooperation and coordination than ever, but we're in an international situation which has completely shattered this. I mentioned war, I mentioned division. We can see that there are fewer humanitarian contributions. There are doubts which have been expressed by some of our joint organizations, which for the last 25 years have produced wonderful results for vaccination and improving health around the world. Now, so that we can have proper protection of our people against health threats, every country must make sure that they have access to data on viruses from all parts of the world, that they're in a position to have access to quality research, that they can produce or obtain medical equipment needed to stop the spreading of disease, whether these be diseases affecting humans or animals. So yes, indeed, we need cooperation so that we can succeed in health. And if there is one field where international cooperation is both interdisciplinary and necessary, it is indeed in the field of health. And this is the very concept of One Health. And this concept is not an esoteric matter that was just in a small corner 5 years ago when it was started. It was based, and it is still based, on scientific evidence, established evidence, and on the real facts which we can all agree on and which we have all seen together. I told you we needed international cooperation so that we can cope with these crises, and we need international cooperation for research too, but we also need to have interdisciplinary cooperation because it has been shown that human health, animal health, environmental health, and food have many points in common, many interactions. Now look at the figures. They're here. 75% of emerging infectious diseases come from animals, and that figure is sufficient justification for us meeting here today. Now, a few years ago, we were faced with a virus which put our societies and economies to a halt, and that was the COVID-19 pandemic. We haven't forgotten that, and we must remember that that became a global phenomenon in just the space of a few weeks. We could also mention SARS in 2003, H5N1, Ebola, and others. The list is too long to go on with all of them. We no longer need to provide evidence to say that when we're talking about global health, we're talking about the need to cooperate between the different disciplines and the different countries. And this year, France has the great honor of being president of G7, and we're endeavoring to build concrete solutions. And hand in hand with Kenya, we're jointly organizing the summit called Africa Forward, which will be in Nairobi in mid-May. And today we are in Lyon, and in a month's time we'll be in Nairobi so that we can move ahead on a number of issues, including health. And tomorrow, more or less, we'll be in Evian for G7, getting the partner countries involved. And that is why this One Summit is so important. It's part of the approach which we saw with G7, getting messages across and moving ahead. And I would like to devote a few seconds to this method and talk about it. This is a method which we've been developing since December 2017. This is the 9th such summit meeting here, the 9th One Health Summit. And this has been done to deal with international order being broken up. Now, we had the first One Health Summit when the United States at the time said that they were going to tear up the Paris Climate Agreement. And so we decided that we would have One Health to save the Paris Agreement. We got scientists, NGOs, governments, cities, companies, and major finances, all sectors were willing to become part of a coalition of players, sit around the table and take action. Then we did it with the ocean, we did it on biodiversity, we did it with forests, on poles, and now we're doing it with health. And this is the method where we get a coalition of players in an international order which has been upset. And this shows that you can have effective multilateralism. And this is part of the Covenant for Prosperity of the Planet, which was in July 2023. And we saw that the coalition of 140 countries and 3,000 researchers and more than $2 billion for transition and massive investments to protect ecosystems, forests, land, soil, and so on. The One Health approach is based on science, and it's interdisciplinary, as I said. And this is a fine reason for developing this summit following that method. And for France, the One Health Summit is part of a long tradition of commitments. France is a joint founder of the Global Fund to defeat AIDS, tuberculosis, and malaria, and founder of UNITAID. We're historic funding party of the Gavi Vaccine Alliance. We're world leader in research, as we can see with the Nobel Prize for Medicine with Françoise Bérensine-Roussy and Luc Montagnier. We're the country which hosts the World Organization for Animal Health, and France is the champion in world health. And we can see that in Lyon here, where with the WHO Academy. Isn't that right? It was, and that was launched in December 2024. And we also have the International Agency for Research on Cancer, which is here. And we have a One Health Institute. So One Health is not just a slogan, it's a real concept, and that's why it's so important. And I'm pleased to be here with my friend and colleague, the President of Ghana, Mr. Mahama. And we also have our colleagues from Botswana, Cambodia, and we have a number of other ministers and international organizations present here today. And we have restated here at the One Health Summit that any progress must be based on science which is free, open, and independent. This is absolutely essential. Global health will not make progress if science is subject to political pressure or an object for a selective approach decided on by the government. And we must have global governance which is fully transparent, and this has to be done properly with all stakeholders involved. This means you have to have international coordination, where WHO has worldwide responsibility and legitimacy, and this covers the work which is done by regional organizations. And we've got our colleagues from the African Union. We spoke with them this morning, and we know that that's an essential role there. And we restated the importance of having a strategy which was developed by the countries and taken on board by the countries. This is the challenge that we're following through. And we can see that there's a real need in health to have an integrated approach, with a country-based approach, which is a combination of ideas from all contributing parties. And the World Bank has made a substantial contribution in some 15 countries, and this needs to be extended so that we can have country-based approaches which are fully integrated, getting all the contributing parties involved, the World Party, the WHO, and the vertical funds and donor countries as well, so that we have a simplified approach so that national strategies can be speeded up.
frère le président Mahama que le Ghana soit le premier
suggested
pays
to President
projet
Mahama
pilote.
that Ghana be the first country for a pilot project, and I think he has the vision and the leadership to do that, and I'm sure we'll be working on that together in the forthcoming weeks. And this summit is also an opportunity to work on very concrete projects, and I'll list them very quickly. We've got an international pact on the efficiency of antibiotics, and we have to make sure that we can have fair and sustainable access to antibiotics. We have to ban the use of antimicrobials as growth factors in animal farming, and we also have the work on the resistance, on antimicrobial resistance, so that we can deal with the threat which is confronting us in that. And today, with 6 other countries, we are giving a commitment today to work with the One Health high-level expert panel, and also to do sustainable work on health in climate negotiations through the CP, and we have that with national contributions and plans for adaptation for the countries. And we saw this with the ambitious action plan from Belém after the COP in Brazil. And that is part of the declaration, or carrying on from the declaration of One Health and Beyond. We're also contributing to a voluntary framework so that we can pool and analyze data on human health, animal health, and environmental health coming from all partners. And thus we have One Health data convergence, which is a better way of understanding and using this data so that we can cast light on political decision-making and develop virtual ecosystems that can be used by scientists to test their hypotheses. So serving decisions by sharing data. And we're also extending the international coalition of the initiative PREZODE, Preventing Zoonotic Disease Emergence, and that was launched at the One Planet Summit in January 2021. And this is to prevent the emergence of pandemics in the future. And these new partnerships are opportunities for us to develop projects that are concrete in the field and to develop networks of epidemiological hubs for observation, description, and monitoring of diseases. We're continuing our political mobilization on the essential Global Plastic Pollution Treaty, which is supported by a declaration by the Scientific Committee, and there's a call for action from representatives in the private sector. And then there's the ambitious bill which was launched in Nice at the 3rd UN Ocean Conference with more than 90 countries present. And here we want to state again today the urgence to have a text so that we can deal with this great scourge. And along with Kenya, Guinea, Cambodia, WHO, Africa CDC, the CGIAR, and the Pan-African Farmers Organization, we have adopted a declaration which is designed to have a harmonized definition shared by all of us on ultra-processed foods and to recognize the health and environmental effects of these. And to do this, we're continuing to support international work which is underway, and we shall endeavor to have appropriate public policies implemented so that we can have healthier and more sustainable food. Last year, we had the Nutrition for Growth Summit, and I'm delighted to see that there was a follow-up meeting held yesterday, and this is contributing to work on our commitments that were made on these essential subjects for human development. And we are now launching the network known as One Brain Health so that we can understand and prevent the impact of environmental changes on brain health. And obviously that means all forms of mental health. But we're not the only ones making a committee. In forthcoming hours here, we will hear announcements of commitments by banks, development banks, the philanthropic organizations, companies, and by governments. And I would like to thank all of them. And by extending these international commitments, we shall be structuring our national work and organization based on a One Health approach. First, we have to launch the development of a new national strategy on health and the environment. We're undertaking a change in food policy with the operation implementation of a national strategy for food, nutrition, health and climate. We're going to have the publication of a national program on nutrition and health for the period 2026 to 2030, and there will be be a national program on food for the period 2026-2030 also. These strategic guidelines will define the policy of the government so that we have healthy and sustainable food for all by 2030, with special focus on issues related to nutrition, public health care, and the sustainability of food systems, and of course of sovereignty of food supply. In the same spirit of preventing emerging risks, France will be publishing a new national plan on endocrine disruptors designed to step up action for better knowledge, for cutting exposure, and for improving information available to the public on endocrine disruptors. The plan is designed to provide protection to the most vulnerable and most exposed groups, concentrating efforts on the most areas of concern, such as infertility, neurodevelopment disorders, and cancer. And France is also giving a commitment to step up the work between science and public decision-making, highlighting its research work and on innovation in One Health approach, doing this on animal farming and on antimicrobial resistance. In addition to having the right work for treatments and measurement of innovation, there's national action which will be based on arrangements such as projects we have with Eco-Antibio, which will help restrict the emergence of antibiotic resistance in animals and the risks related to it. And that is why we are all here today in Lyon. We've got the concrete commitments, and I've just given some of them here which apply to us nationally and also at an intergovernmental level. We want to rationalize our governance, and we have to mobilize the financing. And all of this will be expressed in the Lyon commitments. This will be part of the One Health approach. And to do that, it's for the government here and for the international organizations and international governments and NGOs to take action as well, and for private sector as well. We need to implement the agenda. We have to have innovation. We have to have innovation in our research laboratories so that we can respond to a number of difficulties and to continue with progress. And we also have innovation with startups, with companies that find some of the solutions that we need to have to deal with problems such as the quality of air, food, water, and so on. We have companies with solutions and innovations that can help us take up these challenges. So, ladies and gentlemen, these are the ideas that I wish to share with you today. And at this time when there is such a disturbance to international order, and where some would like to question multilateralism in healthcare. And in addition to these initiatives that I've just listed and the Lyon commitments which the government is leading, I would like to say that France is there side by side with the World Health Organization and with all the international organizations present here today so that we can advocate for effective multilateralism with a demanding vision which is based on science, so that we can jointly make the decisions we need to make. We must not forget what happened in the past, and it is our duty to prepare for the challenges of today and tomorrow. We are duty-bound to do so, and that is why we are here today in Lyon, and why some of you have spent a few days here in Lyon for different meetings which have already been held. So thank you very much for being here. Thank you indeed, and I wish you all the best, and long live the One Health Summit.
Merci. Merci, Monsieur le Président.
Thank you, President, for these announcements that really show our collective commitment, and thank you also for saying that science should really be at the heart of all our public policies.
John Dramani Mahama, President of the Republic of Ghana, to give his address as co-president of the One Health Summit. Excellency.
Thank you very much. Your Excellency, President of the French Republic, Excellencies, Heads of State and Government, Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Mr. Ku Dong-yu, Director General of the Food and Agricultural Organization, and let me just say distinguished delegates, ladies and gentlemen. I wish to begin by expressing my sincere appreciation to the government of the French Republic for convening this important summit here in Lyon, and to the quadripartite organizations for their continued leadership in advancing the One Health agenda globally. Thanks, Mr. President, for the honor of co-chairing this summit, and also thanks for the comprehensive introduction you have given. You really have set the tone for this meeting. We're living in truly interesting times, and much of what we previously took for granted is now being questioned, and our old answers have now become the new questions. To be honest, these shifts and cracks in world affairs are not limited to global health. They have spread across every corner of our shared global identity. But health, and global health in particular, is where things have come to a head. Around the world, we are facing an overwhelming surge of health threats across borders. Every species is in the crosshairs: animals, humans, and plants. And the environmental catastrophe confronting us is in the waves of the sea, it's in the glaciers, it's in the rainforests, it's in the desert storms. In my own country of Ghana, a blight of disease and pests affects smallholder cocoa farmers, threatening millions of households. Illegal gold mining leads to forest degradation and pollution of our water bodies, threatening the survival of precious populations of birds and insects critical to our biodiversity. At the foundation of all these crises is the phenomenon of climate change. And yes, we realize that everything is interconnected. From the outbreak of infectious diseases to antimicrobial resistance, and from climate-related disruptions to food systems, all these risks converge and intensify in frequency, complexity, and severity than at any time in human history. The One Health approach is thus a practical matter for us in Africa. We've traditionally lived our lives in lockstep with nature. We're an integral part of nature. Still, more than 50% of our population rely on herbs and other natural forest resources for their medicines. Our rich cultural heritage stands as a testament to the wisdom of an integrated approach to healthcare. Long before the coinage of One Health innovations, our ancestors had over the centuries mastered the use of plant-based therapies for animal healing, which in turn protected human health. In Africa, our lived experience leads us to accept without question that human survival, animal well-being, and plant health and environmental care form a single interconnected system. This system also integrates prevention, early detection, and swift response into a comprehensive whole that improves downstream medical care. We understand that our national development is rooted in resilient ecosystems and a strong public health system. Since the dawn of African civilization, from Songhai to Great Zimbabwe, from Timbuktu to Axum, and to ancient Egypt, traditional knowledge incorporated systems for diagnosing and treating chronic ailments, for dealing with plagues and pests, and even the practice of terrace farming. This knowledge has always been with us. What has been needed in recent times has been for experience to intersect with it. Over the past decades, we have faced pandemics and plagues, from COVID-19 to Mpox, Lassa fever, and Marburg. Each crisis has highlighted the importance of the One Health approach. We must reclaim our native practices and more actively draw on our heritage of integrated living across the continent. These public health emergencies have also taught us a simple truth, that prevention is not only more effective, but also much more cost-effective than cure. And so in Ghana, our rollout of the Ghana Medical Trust Fund and our free primary health care programs are all new instruments to improve health outcomes for our population. These two programs will aim at lifestyle changes and preventive care, incorporating traditional knowledge. We must also take note of the changing disease burden in Africa, including the explosion of morbidity in non-communicable diseases. In Ghana, non-communicable diseases today account for 42% of all mortality. Infectious disease burdens also are changing, are varying. And so we must take note of all these. The drivers of today's health threats, from climate change and ecosystem degradation to species conflicts and loss of natural barriers, are reinforcing each other. Not to talk about plastic pollution, which is poisoning all our ecosystems. We must advance international action in dealing with plastic pollution. Regrettably, as I speak to you today, the countries that are most at risk have the least resources to cope. This must change. The world must face the stark and uncompromising fact that a healthy and thriving Africa is no threat to anyone. It will be a positive force for global progress. We must therefore ensure fair access to financing, technology, data, and innovation. We need to enhance research and knowledge sharing. Additionally, we must support countries in building resilient systems that can prevent, detect, and respond effectively. Although we have frequently discussed this, we have been slow in developing the necessary infrastructure for delivery. Let's muster the political will to integrate our fragmented regulatory environments, and let Lyon be the turning point. Today, however, I wish to make 3 calls to action, and I hope we can all commit to these immediately. First, let us shift from commitment to action. The period of declarations must come to an end. The moment for coordinated effort is here, and let us start from Lyon. Let us connect our One Health strategies for our national development agendas to a new global framework for public health. The international security agenda must fully adopt this approach as a key element of sustainable development worldwide. And thirdly, let us concentrate on building a new preventive shield and an intelligent radar system at its source. Robust surveillance systems, early warning mechanisms, and community-level interventions are our strongest defense against future pandemics. But these must be smart, dynamic, agile, and interoperable, lest we simply add new bureaucracies to old ones. The decisions we make at this summit will shape the future of global health security. And so let us ensure that they result in tangible, measurable outcomes for our people and our planet. I thank you for your kind attention.
Thank you. Thank you, Excellency, for your words, and in particular for this call for action. I am sure in this room, many will hear it, and many will continue to work together towards this One Health approach. So we're really grateful for Ghana's leadership on global health, and notably on the Accra Reset. One Health repose sur un dialogue entre les disciplines et sur une coopération internationale efficace. C'est pourquoi les Nations Unies jouent un rôle absolument essentiel, en particulier les agences qui forment part de la quadripartite, que j'aimerais remercier très chaleureusement pour leur implication, c'est-à-dire l'Organisation mondiale de la santé, l'Organisation mondiale de la santé animale, l'Organisation des Nations Unies pour l'alimentation et l'agriculture, et le Programme des Nations Unies pour l'environnement. Je vous propose à présent d'écouter le message de M.
Program. Now, I would like you to listen to the message of the Secretary General of the United Nations, Mr. Antonio Guterres.
En cette journée mondiale de la santé, nous sommes rappelés à une vérité essentielle. Il ne peut y avoir de santé durable sans respect de la nature, sans prévention des risques et sans coopération internationale. La santé humaine, la santé animale et la santé des écosystèmes sont indissociables. Pourtant, les ravages du dérèglement climatique, la pollution, la destruction de la biodiversité et les inégalités brisent cet équilibre et multiplient les risques sanitaires, nutritionnels et zoonotiques. Et c'est également une question de justice. Les communautés qui ont le moins contribué à ces crises en paient le prix le plus cher. L'approche « une seule santé », fondée sur la science, la prévention et la solidarité, est un enjeu de survie collective et notre meilleur atout de réduire les risques avant qu'ils ne se transforment en crise. Elle doit nous aider à réduire les inégalités, à protéger les plus vulnérables et à réaliser l'agenda 2030. Faisons du sommet de Lyon un tournant, avec des engagements concrets, des financements à la hauteur et une volonté politique sans faille au service de la santé des personnes.
The interpreters apologize, but we did not have the sound of the video.
Alors, messieurs les présidents et monsieur le secrétaire général viennent de nous rappeler les fondamentaux de cette fameuse approche One Health.
Fundamental importance of this One Health approach. You have to have forward planning of crises rather than just being victims thereof. It's much less costly and it helps avoid disasters. We have to break down the silos in our approaches. We have to leave the silos behind and go for a network approach. And we have to work for the underlying causes in a long-term approach, in an approach of cooperation. We can't do anything without international cooperation. And I know you're all convinced of that. Now, ladies and gentlemen, this summit is going to show just how effective multilateralism can be, and perhaps most importantly, the virtues of scientific expertise. While there are challenges to science now with fake news, fake information, fake opinions presented as a system, but we want science to be the guiding light of our action, to legitimize our action, our policy and cooperation. And this is why the scientific community wanted to convey a message too, which comes from a long way, and I would ask you to look up and listen to the French astronaut Sophie Agneau, who has sent us a message from the International Space Station.
Monsieur le Président, Mesdames et Messieurs les chefs de gouvernement, Mesdames et Messieurs les ministres, Mesdames et Messieurs, bonjour, bonjour, depuis l'espace. Je suis heureuse de m'adresser à vous aujourd'hui pour introduire les travaux scientifiques menés par une communauté internationale large pour préparer le sommet qui vous réunit aujourd'hui, One Health. Depuis l'ISS, je ne vois pas de frontières, seulement un système vivant, fragile et interconnecté. À bord, mes expériences comme EFCO-Finder pour la télémédecine ou l'étude de ma densité osseuse me rappellent une vérité cruciale. La santé humaine ne peut être protégée de manière isolée. Elle est le maillon d'une chaîne indissociable reliant les écosystèmes, les êtres humains, les animaux et notre environnement. Et c'est le cœur de l'approche de ce sommet aujourd'hui. Plus de 300 experts scientifiques mondiaux se sont concertés depuis plusieurs mois et se sont réunis hier pour échanger cette vision globale de la science et de l'environnement au service de tous et préparer des recommandations à votre attention. Comme moi qui admire notre planète d'ici, belle et fragile à la fois, les scientifiques ont rappelé l'importance de la recherche scientifique pour faire avancer la connaissance et alimenter le processus de décision publique et politique. Cela est toujours vrai en matière de santé planétaire et nous-mêmes, astronautes, y travaillons tous les jours. Les recommandations que vous allez débattre traitent des maladies infectieuses émergentes, de la résistance aux antimicrobiens, des pollutions et des systèmes alimentaires, car ce sont les grandes priorités de recherche définies par la communauté. Ils constituent les piliers du sommet One Health. Les enjeux sont nombreux et vastes tout au long du processus scientifique. Mesurer avec précision, comprendre les phénomènes pour anticiper et prévenir. La complexité des interactions entre l'homme, le monde animal et leurs environnements impose de nouvelles approches scientifiques à la croisée des sciences les plus fondamentales, de l'épidémiologie et des sciences humaines. Et ces interactions constituent en soi un immense champ de recherche et j'espère, moi aussi, y contribuer à mon humble échelle. Les contributions de toute la communauté scientifique internationale permettent à la recherche d'avancer en reposant sur le partage et probablement demain sur l'intelligence artificielle pour traiter l'immense quantité de données. Un grand merci aux scientifiques pour ce travail considérable. Le One Health Summit doit être le moment où nous brisons enfin les silos. La science nous montre le chemin, à nous de passer à l'action. La Terre est notre seul vaisseau spatial. Prenons-en soin.
Nous remercions Madame Adno pour ce message très puissant.
For
et puis j'aimerais aussi remercier chacune et chacun des scientifiques qui sont ici présents à Lyon, qui sont venus parfois de très loin et qui ont pendant toute la journée d'hier et même partie de la journée